As you heard for some of the previous patients on some of the conditions that we've treated down at the Wilmington Clinic, I'm hoping you can get a flavor that the procedure is not just spinal oriented. We treat a lot of ankle and feet and legs problems. We treat a lot of arms, shoulders, elbows, headache problems, chronic pain syndromes. I think we'd all agree that a 2-month-old baby, a forceful type of jerking of the neck or the back would not be indicated. And I think we'd both also agree that a 102-year-old individual, that kind of method would probably not be the safest thing to do. That's the two extremes that I've treated patient-wise. The youngest is 2 months and the oldest was 102. Well, I look at it like this. If it's good enough for those two extremes, why isn't it good enough for the guy in the middle? So if a guy's 20-year-old, 40-year-old, 60-year-olds, it doesn't make any difference. I have a lot of patients in the seasoned citizen age, the 65-old patient and older, that these kind of methods are very safe, can be intertwined with them. And we also incorporate exercise therapy and many times nutritional and dietary therapy to balance them out and help them achieve a better lifestyle, because it's not just one thing. One thing doesn't solve everybody's problems, folks. It's actually an integration that helps the patient. And I can only do as much as the patient will bring to the table for us to work with. That's why I mentioned to you before, you and I will work together as a team. And my goal is to try to get you from point A to point B. We try to be pragmatic about it. We have outcome-based individuals where you're going to be using different methodologies to make sure you're still responding to what's being done to you. And we have so many variety of different things available here. I mentioned before about acupressure, that, trigger point therapy, etc. Sometimes people say, what about acupuncture? Because I do supply that also. I'm certified as an acupuncturist. I'm board certified in chiropractic orthopedics. So using that type of approach, acupuncture is very beneficial in certain type of chronic pain patterns that we add to, but we always start out with pressure. Why? The federal government has just done major research on myofascial trigger point pain, quote unquote, the $25 word for acupressure point, acupuncture point, the $25 word for a knot. Everybody's wife or husband has found, oh man, honey, there's a knot right there. That's the one. That is potentially an active trigger point, triggering some type of sensation in the patient's body. We use pressure, etc. But the federal government has just come out with a huge study through the National Health Institute that the presenter, who was a medical doctor, physiatrist, and a PhD in research, had stated that the only way you can find out if you have these myofascial trigger points, commonly referred to as acupressure points, if they're active in your body, is the 10-finger exam. There's no fancy machine, there's no fancy blood test, there's no fancy MRI to find these things. You have to feel for them, number one. Number two, they also decided that the best approach to treat them initially was pressure. It was the least invasive, the most successful aspect to it. Now, the reality is that many times you have to complement that with. So I utilize acupuncture as it's needed. Quite frankly, there's another manual procedure that I got certified in. It's called Graston's procedure. It's using an instrument to try to stimulate the spot. We use electrical stimulation, hot, cold, laser. The federal government approved laser now to be used on trigger points. The variety of stretching methodologies, a lot of that you are exposed to through the physical therapist or at your trainer and so on, is to try to help minimize the effect of these areas. But the bottom line is there's a variety of different approaches, and that we try to utilize them, as many of them we can, to help the patient's situation. We do a lot of things with knees and other joints. So again, just to give you the realization that it does do a whole host of other areas besides just the spinal. The spinal aspect is appropriate, as well as the other aspects of the body.